My name is Pauline Wajiko Kibui, and I'm 29 years old. I have a background in biomedical sciences, and prior to that I had a background in biomedical laboratory technology. I got selected as a Merck More Than a Mother campaign embryology trainer through the Kenya Fertility Association, and through the doctor who is working in this facility. She knew that I'm qualified and she knew my profession, so she forwarded my name and they scrutinized my qualifications, and indeed I was qualified. So they gave me the chance to represent Kenya in the embryology training in Indonesia. Training a Kenyan embryologist and in Africa as a whole, it has much more benefits, especially to the entire population who are facing the infertility problems. And this will be of benefit because then their services will be available to the local citizens at a very good price, and also the quality of services will be high. It is going to help very many couples, and especially the women, because women are the ones who suffer the consequences of infertility, either if it's coming from the man or the woman. The woman takes all the blame. So for the women, it is going to be a good advantage, because with this service, they'll be able to get a baby of their own and to be able to live like other women, and to stop seeing themselves as inferior from other ladies. In Kenya and in Africa as a whole, infertility is a very sensitive topic. One being, there is no family or clan that does not want to have continuity of life. So being infertile then cuts short a generation, But if there is bearing of children, then there is assurance of continuity of a clan or a family and the name. So based on the African culture, a couple or a woman is not a woman until she gets a baby. But people still don't realize that even getting babies is a personal choice, and every human should have that right of deciding whether to have a baby or not. But being infertile has caused a lot of problems, like many people even go into depression, because then there is isolation from the family, from friends. There is that stigma that people go along with, and at the end of it all, they lose self-esteem. So you find that they cannot collect themselves up and do something on their own, because they think the society is seeing me as an outcast, like I'm not worthy, I'm an inferior, I can't even advise the young kids what to do because somebody doesn't have a child, which is a wrong perception. But then for people who are willing to have the children, they should be helped in case of infertility problems, because infertility has two levels. We have the primary and secondary levels. So if this person got secondary infertility or even primary fertility and they are willing to have a child, they should be able to access these services. The Merck embryology training in Indonesia will actually bring this sector into the limelight, because it will then help the services be available to very many couples that are willing to bear a child, through reducing the costs. Because when the Merck trains the Kenyan embryologist, then the cost of getting embryologists from outside the country will cut down the cost of the entire service. So the locals will be able to access this service at a reduced price, at an affordable price that they can make to pay for. So at the end of the day, the patient will benefit a lot, and it coming closer to their doors, I think they should be able to access this service at any time and at any given moment and at their own convenience. The Merck More Than a Mother campaign should set the trend, and now the health sector should actually put much more efforts in making sure that treatment of infertility is also incorporated into the health system, because infertility is not treated as any other ailments, or is not covered by the health system. So it's it's an optional thing, but then it is caused by these other normal diseases, the reproductive diseases like endometriosis, And if you can't access treatment of endometriosis, then you eventually have infertility. The government should be able to provide an option for treatment of you to regain the fertility that you should be able to exercise your right of having a child. So all stakeholders should be involved, and they should come on board to streamline even the guidelines on what should be done. The registrature should be there. How should the doctors and the embryologists treat their patients? How should they handle their privacy or handle their specimen? To what extent should they engage the patient, So it should have a regulation. It should have a lot of guidelines. It is a very sensitive area, so it should also be handled with very high level of caution. It needs not just to be done for monetary gain, but also for the value of the patient and the quality of life that they are going to have even after the treatment. So all stakeholders should be involved at whatever level they should be involved.